Oh, okay.
All right, sorry, that was such a, I didn't mean for you to read my entire bio. Good afternoon, everybody. It's so great to be here. I am going, first of all, I wanted to actually comment on, I love the fact that the tablecloths are these suicide prevention colors. So really, I don't think I've ever seen that in the room before, other than you, so I really appreciate that, you guys. Both put this together, the purple and the teal. But before I go any further, I'm gonna have Julian, my colleague over here from LAPD, introduce himself. You read your extensive bio, please.
My name is Julian Canales, and I'm one of the senior lead officers in Los Angeles Police Department Mental Evaluation Unit. And we'll talk a little bit more about that during this presentation. That's it.
Well, yeah. All right, well, Julie and I am very excited to be able to talk to you guys about navigating crises. This is I was here last year as well. Some of you guys may have heard me speak on 988. At that time, we were just about a year into it. Now 988 is 2 years old. Tomorrow on 9/8 is going to be 988 day. Contrived, I know, but the federal government came up with that, not me. So think about that. So tomorrow is 988 day, and for those of you who are not aware, the 10th of September is International Suicide Prevention Day. So that's another thing for you to hear. Okay, what are we going to talk about, Julian? Okay, we're going to talk about what if. Okay, this is kind of like the entry into this particular presentation. So our thought was, really and truly, we're used to calling 911 for emergencies, right? But what if, can I have one of those roaming microphones? A little bit easier, please. Thank you so much. Okay. So what if anyone experiencing a suicide or behavioral health crisis could get the right kind of crisis response at the right moment, at the right time? And what if we have more than just law enforcement to respond to these kinds of crises? What if we had just more than one place to go, right? Does it have to be urgent care, emergency department, or are there other places to go? Which leads us to that question, what if we have more than one number to call, right? Not just 911. So I actually don't think anybody really touched upon the latest suicide statistics, and it's kind of like follows along what Dorothy was talking about. We have to talk about suicide because the numbers don't lie. What do numbers say? You can see here all of them up there. So we have roughly, this data, by the way, comes from the SAMHSA puts out a national, it's moving by itself. I don't know why it's doing that. Is it set for automatic forwarding?
Go for it.
You just keep pushing that. I don't know what it was, if it is or not, it could be. All right, bear with us. Okay, so SAMHSA, which is a Substance Abuse Mental Health Service Agency, which is the part of Health and Human Services Department, the federal government, right? They do a national health survey every year. So based on this very large sample size, this is where these numbers come from. They are obviously still estimates. As a matter of fact, I usually get these numbers from the executive summaries, but not that long ago, I actually took a deeper dive at the report itself. And I noticed that a lot of people, when asked these questions about serious thoughts of suicide and attempts, fill in, prefer not to answer. So who knows what the real numbers are, right? You can kind of see how many people are impacted by it. So let me say it out loud. 13.2 million adults and an additional 3.4 million adolescents a serious thoughts of suicide. This is in 2022, the latest year for which we have this data. 1.6 million adults, adults, and 953,000 adolescents made an attempt in their life. Ultimately, we lost 49,476 people to suicide in this country. It's the 11th leading cause of death. In previous years, it's been the 10th leading cause of death. And unfortunately, the numbers continue to climb, although I do want to know that for youth, this is for the first year coming out of COVID, right? We've been very concerned about the mental well-being of our youth. We have seen attempt and thought data rates go up, but actual death rates have gone down for youth. And this is the second year in a row that we've seen that, which is interesting. I don't know if it's going to continue that way, but it hasn't been the case prior to this. So basically, this is why we need to talk about suicide, right? This is what Dorothy just told you. These numbers are so significant. Why then is there still that much stigma? And so that is really also why the National Suicide Prevention, Suicide now 98 Suicide and Crisis Lifeline exists. This is who we are, just very briefly. I can also reference Dorothy here because our founding father was Ed Schneidman, so we really were, we have an amazing legacy, the very first suicide prevention center in the country, creating that hotline. And we've been doing a lot of different things, and was already previously noted that we are one of the largest centers in the entire, it says one of, but it's basically we are the largest one. So LA Center is the largest one in the 98 network. Next slide, Julian. All right, but I'm here to talk about 911. This, as you can see, spans a really long time span. It's started in 2005 is when I first heard, at that time I was the crisis line director of our hotline. That's when I first heard about this program in New York City, with the New York City Crisis Center had an agreement with NYPD to try and send some of their calls that they called emotional disturbance calls, I think it was something like that, EDCs, to send them over to the hotline instead. And I heard that, I was like, that's a really good idea. I want to do that. So that program wasn't necessarily long-lived. I don't know how long it was in existence for. It doesn't exist anymore. But I got that idea and I was like, I got to get somebody here in LA to want to do this with us. And then it took a long time. Ultimately, in 2016 is when I finally got connected to Lieutenant Brian Bixler at the time, one of your bosses.
Yeah, one of our bosses was, so our lieutenant was the gateway for her to come to the big gorilla of the city of Los Angeles, which would be encompass the most 911 calls in the area if we were to put it together. So Sandri then began the process with Lieutenant Bixler to try to, I guess, put this together and convince the city government to say, hey, let's partner together to do it. But it's not a very quick process. Think about the city of Los Angeles like a big freight liner, and it takes forever for it to turn. That's what Sandri ran into. But
that's a great analogy. I've not heard that before. Yeah. So it did take us about 4 years to get the funding, but everything kind of came together in 2020. In 2020 were the George Floyd protests, and there was a lot of talk everywhere about defunding the police. And I still remember I was actually on the freeway and I was hearing our mayor, Garcetti at the time, talk about this. And I was like, no, let's not defund, let's just shift it. And I think right afterwards, I called up Brian and I was like, Brian, this is our opportunity. Let's see if we can get in. And it really happened that quickly. It was probably a couple of months after that that I heard that we got funding from the Mayor's Innovation Commission. And they said, they gave us a green light to try this out for 8 hours per day. We pulled together everything that we pulled together and ultimately got it launched in February of 2021. Initially, that was 8 hours a day, but we quickly realized it's much better if it's 24/7, and so that happened 5 months later. Now, and that's why it says over there pioneers, because now this idea of 911 diversion is part of the national vision, part related to 988. But also what is interesting to note here is that a year ago, AB 988, is a California Assembly bill, passed into law. And it actually mentions something about that. It talks about how 911 should send over some calls to 988. Now, they didn't attach funding to it. Not good. And they also didn't attach clear guidelines, also not good, but that's okay. We've come a long way. So that's kind of why I chose, this, I think this is the 110 downtown overpass, all the roads coming together. It's been a long road. So that's also why that's in my brief bio, because it really has been one of my passion projects, and I'm just so excited that we got it off the ground. All right, so moving on. Why do we do this? So I'm going to talk briefly about, and you probably already noticed, the impact on community members, and I'm going to let Julian talk about the impact on first responders. So community members, those of you who have been through this or have maybe heard loved ones go through this, it is not fun when you have to call 911 for somebody who's experiencing a mental health crisis. And a black and white shows up, sirens, neighbors sticking out the window, their noses, right? It's very dramatic and also traumatic. And oftentimes these things can, it has everything to do with stigma, by the way, right? But oftentimes these things also lead to involuntary hospitalization. Even if you ask for help, that still is sort of the pathway to that. Talking about stigma. Sometimes ambulance bills, hospital bills. You were already in a crisis, now you're gonna add more to it. I know, it's just, you just stay on that. All right, so, but it's not just us who are impacted by that, right? Obviously, there's a reason why first responders don't necessarily need to want to go out into these kinds of calls anyway. So you can talk more about that.
So the other part to this is, what officer really did sign up to be a social worker to go out to handle somebody's home problems or not problems, but issues that have developed over years. And many times we show up as a stranger, 22, 23 years old, and everyone's looking at us and say, fix it. It's not going to happen that way. At the same time, our main job is public safety and law enforcement. It's in the name that we have. So that makes it very difficult. We wear many, many different hats. So you never know what you're going to get. It's all based on that life experience of that officer when they show up, what they've done before, how they can handle it. We're all different, just like any other job or profession. Some are better than others. That's the reality of life. For those that have called 911, you have probably been through that. And then the other part is, as time has gone on, we started thinking as law enforcement in general, we said, what crime has been committed? Mental health is not a crime. Wanting to commit suicide is not a crime. So in LAPD, our SWAT actually got together with our lieutenant. Oh heck, there we go. And we came up with a disengagement policy, a tactical disengagement, saying, how far are we going to take it? Are we going to go in there and harm you to keep you from harming yourself? That is the hardest part, because as officers, you want to take action. You want to handle the business in the moment, because the rest of society is looking at you and they're all looking at you and saying, do something. Very difficult for an officer to say, you know what, we might have to step back, and everyone's looking and going, but you're not going to do anything. And we always ask, what crime was committed? That is our main job. That's why we are having this discussion right now, because in the course, forever and ever, as children, we have all been trained in a time of crisis, 911. There was nothing else. good luck trying to remember that the county access number, 1-877, blah, 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 or any other number. Call your doctor, answer machine. Very difficult. So officer became the de facto response. Now we're doing a paradigm shift. Obviously, when we speak for LAPD in the city of Los Angeles, but overall, it's happening. Okay, but we'll talk more about that.
Well, I can say a little bit, when you wanna go back to that one slide, so we're gonna do. No, I know. So you may be wondering, what's Mr. Incredible doing up there? So for those of you familiar with the film, the opening scene of that movie is a suicide attempt. It's a person jumping from a high structure. And Mr. Incredible comes in being a superhero and scoops that person up and puts him down and saves his life. And then he got sued. Right? Because the person said, basically, I didn't ask you to save my life. And it is, so the analogy, this analogy actually came from Brian Dixon, who talked about that. The moment he saw that movie, it reminded him of the challenging position that law enforcement sometimes is placed in. And that's really the reason behind tactical disengagement. So really what that means is, and this is becoming a very common practice for a majority of police departments in the nation. What that means is you go in, you've been called out to the scene, and a person may be experiencing a mental health crisis, but they do not want to engage with you. It's not against the law. Nobody else is at risk. They step away. So there could be a person with a gun or with who knows what, right? But they don't want to engage with responding personnel. Responding personnel walks away. That person ended up ultimately with no help at all. So what if, going back to that, what if that person calling 911 had been sent over to 988 instead to the crisis line? That's what I'm explaining. Because ultimately, we're all in the same business. We're just trying to support people in crisis, right? We just have slightly different scopes. And I purposely chose this particular picture. I think that's a really important thing to do because so this is Sergeant Chuck Coleman with LAPD. He's talking to this young girl who had been on an overpass, and negotiators came in and talked her off that ledge. And then they sat down together because he had a daughter her age. And she reminded him of his daughter. And now he's a dad. And he used his dad to support that person. And so we're all kind of these human cogs in this wheel, and with a lot of passion and compassion, right? And so it's important to understand that we can therefore all work together, just slightly different scopes, but working together is very important. So this is an often used infograph to kind of illustrate what happens, the difference between calling 911 and calling 988. So if you call 911, very typically, there's two options, right? Fire or police, and fire often also includes ambulance, right? That's it. What if you call 988? If you call 988, I know, just stay on top of that now. Sorry. If you call 988, there's a lot more options. First of all, 95%, this is network-wide, by the way, is resolved entirely over the phone. No in-person response is needed. But when an in-person response is needed, our first go-to is going to be mobile response teams, who then hopefully can take a person to a crisis stabilization center or a respite center and not having to end up going to the hospital, right? And all of that starts to include follow-up services, so crisis, post-crisis wraparound. Look at the difference between the two. So the more we utilize this other system, the less we end up people being incarcerated, and you all know there's a lot of mental illness in jails, in prison, or people ending up being hospitalized against their will. Okay, so that's really the idea behind it. So how does 911 diversion work? 911 to 988, LAPD. So it's a little hard to see. I'll give you a quick overview. Basically, a call comes in. If a call is noted as a mental illness, possible mental illness, suicide, possible suicide, those types of calls, now we're going to assess eligibility to be transferred over to 988. If not, if they're not eligible, you can see right here, and this happened at the same time, and Julian is going to talk more about the SMART units, but both patrol and the SMART unit, which is the co-responder team, is going to be sent out. Next slide. These are the reasons why a call does not get sent over to 988. Okay, these are public safety issues. Office safety need medical attention. If they're on a high structure, if they have a weapon and are in public and there are other people present, or even if they're inside their own home and have a weapon, but other people are present, right? So this is sort of like there's an endangerment here. We need law enforcement to respond. Next slide. If not, calls get sent over to us. And we get this basic information, an incident number, caller's phone number, location, and name, and just kind of the reason why the call was sent to us. Then we basically handle it the same way we do all of our calls. Just any crisis call. We do exactly the same thing. We do risk assessment, we do safety planning, we provide support, de-escalation, and we make sure that we have a look back into LAPD in case we do need them.
So one part to this is that 911 operator that did not sign up for that, also just like the officer, is doing that. So that took some training with Didi Hirsch for them to make that triage in the moment. I will have a checklist for you that would help you if you ever have to call 911 so that you can get your needs met and be as efficient as possible.
So just very quickly, I want to show you some outcomes. So again, you can kind of see that the majority of the calls actually get in. We don't need anybody to go anywhere. But it's definitely much higher than what we see traditionally, which makes sense because people call 911 for a reason, right, to begin with. But only 4% end up needing 911. The rest of them who do need an in-person response, right, end up going to the hospital themselves, or they get somebody to transfer them, or they can call mobile response, or we connect them to mobile response. So already removing law enforcement primarily away from the situation. Interesting difference I want to point out here. So we get way more male callers from 911 than we do from 988 directly. So that's a significant difference you can see there. And then the next slide. This is one outcome we did not expect, but it's very interesting. You can see right here, look how many more African-American callers we get through 911. Suddenly, this data, which we didn't expect, made us super, like, we are needing to do a much better job with equity and access, right? So, and we're getting so more males, more Black males, who traditionally, as we know, going back to the George Floyd protest, for example, you would expect to be less likely to go 911 to begin with. But that's where they start. So this is not, we are working currently with USC School of Social Work to do an evaluation of this. And this is one of the interesting outcomes that we found. So very briefly, we're going to wrap it up. We want to give you just a couple of highlights of the types of calls that were sent our way. So this first one was a woman who I think was probably a frequent user of LAPD's system. It happens to most emergency services, we do get those. Call often and to let people know, like, somebody's coming into my house when I'm not there and they're destroying all of my property, right? So that call, and nobody believes me. That call is sent over to us. And we provided her with a lot of emotional support. It really helped her feel better. And she was particularly grateful when we reached her at the time to follow up call, that she gave her the opportunity to talk to her 21-year-old son, who's been supporting his mom, who's been dealing with mental health issues for some time, how he has a place to call as well. And then this next example, this came actually early into a program when I found it very striking. So this was a dad who had a 6-year-old little girl who had lost control. She was very, very upset, and she said things like, I don't want to live anymore. Okay, so he didn't know what else to do, he called 911. That call got sent over to us. Now instead of sending law enforcement, got to talk to a crisis counselor, did breathing exercises with this little girl, which totally helped calm her down, talked to dad, provided him with support. And all of this happened, I think, about a week after a kind of a national case made the headlines. It was a 9-year-old little girl who was handcuffed and put into a police car. It was a very similar situation, and it sort of like raised nationwide concern about the way we handle mental health crises. And so I thought it was particularly striking that we got a call like that.
Yep.
And this, I will lead into this, and then Julian will take over. So just to make it really clear, and it's not, it really is not, but we're trying to get the messaging right. When you go 911, when you go 988. So when you have a medical, police, fire, or rescue emergency, you call 911, right? If you have any sort of urgent suicide, substance use, or mental health crisis need, you call 988. 911 is focused on dispatching. 988 is focused on resolving the crisis over the phone or chat or text. In one more click. I already noted that over 95% are stabilized through crisis lines without any type of in-person response needed, and then one more click.
Yep.
And then for us, it's less than 1% of our call volume requires an emergency intervention.
So that it gives them a doorway. So just because it goes into the 988 system from ours, doesn't mean it can't come in. It's very helpful.
Okay.
So where am I at now? So what to expect from 911 or 988? We already spoke about the 988 portion, the stabilization to help that person, so that way no response has to be provided. But the one part we haven't really spoken about is that the person has to want to be transferred to 988 from our 911. Many times, but not many times, but sometimes our 911 center will say, I would like to transfer you over to the 988, would that be okay? And they will say, no, I want somebody to respond. So our 911 center will actually note that in the call itself, so that way the officers know we try. And so let's get to when 911 is right. So when it's necessary to call 911, everyone should have had, or at least it should have been spread out a little QR code. If you put that QR code or look at that QR code, this 911 checklist will be on there. What is the reason for 911? Why should you have to call 911 if it's necessary? The first one is obviously the act of violence, threat of violence, meaning the immediacy, the now. Is it happening right now, and do you need officers to come out? Is it necessary to have these strangers come to your home to respond to make the situation safe? That's the biggest thing about 911. Not, well, I was talking to my family member and they made a slight comment, and yeah, I need officers to come out. That would better be suited for maybe 988 or even the psychiatric mobile response team. 911 means you need that officer, you need that uniform to show up right now to make it immediately safe. And then the second part is if you need ambulance services. We came up with this 911 checklist that you see up here because we realized one thing. What we did a while back is we actually audited all of our uses of force in our city that had mental health related call to it. And we realized we asked ourselves, what can we do to mitigate any uses of force? And so we looked at it. We can't control the people that call. We can't control the situation because we're reactive when it comes to a call itself. But the one thing we can try to control is how much information comes to us because we looked at it. Think about it. You ever had to call 911? You might have a story in your head. The moment you hear 911, what's your emergency? It's out of your head already. It's immediate crisis. So we created this 911 checklist, so that way it's specifically made for mental health crisis, but you can use it for anything, just delete whatever you don't want as you go by. We made it into a PDF under that QR code so that you can put it onto your phone under your PDF saver and have it with you at all times if you ever have to call 911. We did it on purpose because that's the one part that can be controlled in the moment. Because believe it or not, the officer that comes out, unless you have that same beat officer and you're that home that always calls 911 and shows up all the time, is gonna have no clue the history of your loved ones of why you're calling. You're gonna have it, you're gonna know it, they're gonna know nothing. That 250-pound loved one that you have that you see as a 5-year-old and you love is 250 pounds of rage in the moment. So the officers see it as that, they're not gonna see it with loving eyes that you see it. So keep that in mind. Perfect. So reality, you're gonna get uniform officer when you get 911. The second part is we might handcuff in the moment. That's for the safety for others. That will shock the senses for a lot of people because you said, how dare you handcuff my loved one for a psychiatric emergency? And I'll say, how dare you come to along? Why did you not call your psychologist or psychiatrist? That's because you have to call police. That is something we have on us in the moment to control the one thing that scares us. Think about it. Look at the show House. What is the one thing that scares us every single time? Over at one, we can't control. We have no idea what's going on. We handcuff, we take that away, we can slow down. That gives us opportunity to render the situation safe. The reason why we put it in that 911 checklist that I showed you is because mental health can follow the same trope as domestic violence. I am handcuffing your loved one, your son, daughter, who you've taken care of, only that, and you're the only human being that has ever loved that person, everyone else discounted them. Yet when I'm handcuffing, you're yelling at me and telling me, how dare you? You are doing wrong. What do you think your loved one's gonna wanna do? Defend you. Same as domestic violence. You know, how many times I'm handcuffing the bad guy and here comes the victim jumping on top of me. Same trouble, same trouble. So we let family members know when I do these trainings. Cry on the inside, scream on the outside, stoic, tell your family member to cooperate and just listen to the officers. Because guess what? Even if we're wrong, at least we're not harming your loved ones and everyone wins at that point. And then the last part, reality. We are there for crime initially. We are gonna do a full investigation. If a crime was committed, your loved one might get arrested. Now for us, we created a crisis response support section. So we actually advocate and will advocate in court many times if your loved one gets arrested. And I'll talk a little bit because I have about 3 more minutes on break.
I'm sorry, don't we have until 40?
It's going into the Q&A.
We're good.
Oh, okay.
I'm fast, don't worry about it. So,
Make sure.
in the 90s, we actually implemented our crisis response team in 1993. We can't take credit, the sheriffs actually started that. We took over, we actually did it at the same time. And it's a collaboration between LAPD and LA County Department of Health. Like any other program, it starts laughable. 1, 2, 3 officers for a city that's, I'll skip this part. Not too far. For a city that's 450 square miles, but as time went on, we actually grew our program. And I'll talk a little bit more about that. So we are officers and detectives specially trained in mental health, and our partners are LA County Department of Health. So LA County allocated about 75 clinicians just for the city of Los Angeles alone. It sounds like a lot, but we're really, us SMART team are really only handling about 35% of the calls. Even though we're doing diversion and we have all these things, we're not catching up. The call load continues to grow. The SMART team is our meat and potatoes. That is our response team that we have. That's an officer and clinician that respond with the officer to assist the uniform officers or to do the crisis evaluation. We have changed a few things. We used to only go for the crisis calls, but now we're going to more acute calls like barricades, people armed with guns. I went recently to a gentleman who stepped out of the house, shot a shot in the air and then barricaded himself in the home. We now send SMART teams just to give history information on the person, both from us and our county partners. County partners have to be a little careful because of HIPAA, so they'll give only what's ever pertinent in the moment to help that person itself. We are citywide. Everybody in the city of Los Angeles is our client. I don't care how old, young, disability, non-disability, rich, poor, it means nothing to us. We're gonna respond because everyone in the city is our client. And then like anything else, we evolve. I told you that we started in 93. In 94, we kind of made the team program look like how we look like. In 2016, did you hear 2016 with Sandri about the diversion program? We grew our program to the point where it is now. We didn't need 2020 to do that, we started that in 2016. And then in 2021, we realized we're not doing a service to the community by being secondary responders. What I did not mention is we were always secondary responders. We would start our day, go to the four corners of the city and wait for a request from patrol. Now what we try to do as best as we can is try to get there at the same time as patrol officers to assist in the call when they're mental health related. Saying the evolution, our fire department started an APRU program, and that is a nurse practitioner fire rig that has a nurse practitioner that can actually do psychiatric evaluation and transportation. Because believe it or not, no fire department can do involuntary hold and can transport your loved ones against their will for medical, regardless of what you want. As long as they're available to talk, they will not transport. And nor can they. Keep that in mind. Last part, and I'll end with this. So our city was continuing to evolve. Most of you might have heard this in the news. We began what is called the Circle Team. That's by Urban Alchemy. Their job is to respond to non-urgent calls running by the 911 center. And really it's more quality of life thing for the in-house population. And they are run by Urban Alchemy. And then the last one is the unarmed model crisis response. We have that in 3 parts of the city with 3 different providers for mental health related calls that are not urgent and not dangerous. These are the stats for diversion. So far what we've had, we've given Didi Hirsch 823 calls this year. UMCR went to about 1,600 and almost 10,000 went to Circle this year alone. And our call will continue to go up. So the need is high.
And I do want to know that I literally just Thursday afternoon I was at a meeting with the mayor's office and LAPD talking about the success of the diversion programs and the importance of growing them and strengthening them. And I was really optimistic. It left me very optimistic. So needless to say though, things are far from perfect. So there's a lot of work still to do. One of the things that we need to do with 911 diversions is just further adjustments, which includes getting 911 dispatchers and 988 crisis counselors to better understand each other's work so that 911 dispatchers feel, yeah, we should send this call over to 988. This is appropriate. But that really takes time. It's a big culture shift. And we do that through listening. Can you go back one step? We do it through listening sessions and things like that, ongoing training every time we go into a roll call and provide training. And I've done that together with Julian before. It's just a reminder for the dispatchers that these programs exist. We see the numbers increase. Back again, sorry. I already mentioned that we're doing a research study with USC to look at the outcomes of this. And then there are still things that are not working correctly. Like we cannot yet dispatch mobile response. It still needs to go through 911. Not necessarily ID. Can you go back one more? Sorry. That's craziness. Not necessarily ideal, but we're getting closer to it. And then the final thing was on the last slide as well is what we're trying to really establish next is a community-based advisory board. So family members and people with lived experience from the community telling us, yes, this works, or this doesn't work, this is what we want. So that's sort of our major next step. There is an increase, we're just about to onboard the LA Sheriff's Department in Lancaster Station, as well as Pomona Police Department. So this is growing. We need to build up our capacity first. But there's just a lot of these things that are happening in crisis response that we really ultimately, the idea is that we really did go from just this idea of what if to let's just make it happen to let's make it better. Okay, so that's sort of where we're at. There's a lot of good stuff. I am highly optimistic. I believe in change. You heard earlier Stan talk about the safe harbor law. I want to make a quick note about that is when I served on the mayor's challenge team for veterans and military families on suicide prevention, we recognized we were like this group of people, included LAPD members, included LA Sheriff's Department members, and we're at this policy academy in DC. And we recognized, actually, when we tell people, just give your gun, your firearm to a loved one, somebody you trust, we're telling them to break the law. And when we came back, there was a bill that was being put out by Senator Portantino, who was like local to this area, and he just put something out, and we're like, hey, can you add this language to the bill? And he did, and the bill got passed. And so we make that happen as a group, and I'm here, this is our call to action, like, don't you believe for a second that you cannot make change happen, because you definitely can. Like, it took me a lot of time to get it out, but we can make it happen.
I have one, actually a couple online. Are you fighting politics to differentiate between 911 and 988 calls to allocate appropriate services? If so, why would it be so difficult to get necessary support?
So in California, that bill that I mentioned earlier, AB 98, it did pass a fee, and so all of you all here, if you live here, you should have it's not a large fee, but there should be a few cents allocated to 988 on your on your monthly telecom bill. Same for 911. 911 obviously gets much higher services, a higher percentage, 988 a lot less, which is understandable. But we're one of only, I think, 8 states in the entire country that have passed that. So we are building that up. Politics are definitely really important, but I feel in California we're on the right track.
Thank you.
Hi, I just want to say thank you for providing all of the data on the progression of how 988 has now served so many different purposes, but also what is the difference between the SMART and the CIRCLE in addressing like suicide issues?
So SMART is for immediate crisis response, meaning we need to go for an actual crisis evaluation. Person is threatening suicide, there's a weapon involved, or police have to go out. CIRCLE is quality of life for unhoused individuals, really not meant for psychiatric crisis at all. Even though they do have that built in, they do have that, but it's not meant for that. That's the unarmed response, the other program that we have. And they're really meant for not acute calls. They're really meant for lower level calls.
So CIRCLE doesn't address.
No, they cannot, because they're not medical. They're really meant for quality of life for unhoused. That's what's.
Yeah, they may go out to that, but then when that is the case, that's out
Yeah,
there.
they will not go if a law enforcement presence has to. So all overdoses are always police response. Yeah, so CIRCLE will not go. There's limitations based on the program urban. That's the limitation.
I saw it on the slide, but I didn't really hear it.
Yeah, I had to go quick. Ran out of time.
I'm coming. Until she gets there, I'll ask an online question. Despite the increase of suicide prevention resources, suicide rates are going up. Why is this happening? And is suicide always preventable?
Yeah, it's a good question. So it's very challenging. Suicide is a very complex issue. And if we were indeed to go by the only way that we can measure positive outcomes is by seeing those rates go down, nobody would fund suicide prevention programs because they will continue to go up. So on our crisis line, for example, we ask something about self-rated intent, which has to do with how likely are you to act upon your suicidal thoughts and feelings at this time. We ask at the beginning of the interaction, at the end of the interaction, and we see a very significant, statistically significant decrease. So we know it works for crisis lines, but suicide is much more than just, that's a whole different presentation, but it's not just about mental illness, it's also about stressors. Stressors play a very significant part in suicide, and look how stressful our world has become and continues to be, and probably growing. And I think that is something that
That's also why I believe suicide prevention is not the job of those who work in mental health, it's the job of all of us. We all have a role to play in that, because it is that complex and complicated.
Also, I think it's great that you have the specification that a uniformed officer will be going on the checklist, because having the presence, sometimes people call 911 and say, I need help, not realizing that help will be a uniformed officer. That can further activate how they're feeling. But also wanted to ask, you mentioned going to roll calls. When you go to roll call, do you ever provide any type of suicide prevention training for the actual operators or police officers?
That would be for me. Yeah, we actually have a pretty robust program. It still happens. We still have officers that do commit suicide. Obviously, in our profession, it's much higher. In my city, we actually have multiple layers of, from our behavioral science section to just our personal insurance. Our union itself has also another number, and it's all posted within all the divisions. If you ever need help, we have chaplains also, so a lot of our supervisors are chaplains. So if you ever need a chaplain, you kind of just go nudge, nudge, and off you go to a room if you need that time. So for our officers, and same thing with our operators, the thing about it, the hardest part is to get an officer open up. We have realized one thing, the younger the officer is, the more they're willing to open up. The older, like this guy right here, the less. Because we come from different generations. My generation is suck it up, move on, work, 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 and then rest when you die. And the younger generation, they're more apt to open up and talk. It's mind-blowing to me, but it's great because they are willing to talk. So obviously, like anything, there's a paradigm shift.
And also you shared with me, Julian, earlier today, actually, that the part of your job where you had to be sitting on a 911 dispatch was the most stressful.
Yeah, but when I came on the job a long time ago, we had to do 911 for 3 months. First job I've ever had to do a 911 operator. I would rather talk to my wife and my mother-in-law to see my hats off to them. It's like, oh, listen, it's not as we're gonna do this.
I also, actually, this is a great opportunity for me to give a little plug to, we actually have, and so the work that I've been doing with Copline is a national hotline staffed by retired police officers. And it is also meant for dispatchers, firefighter, whoever considers himself to be a first responder you can call. So first of all, that's a resource that's out there. And Didi Hirsch is just about to launch a support group for first responders called Blue Harbor. And it is going to be free because it's grant funded, and it's going to be co-led by also retired law enforcement officers. So there are resources out there, and I think it's, thank you for bringing that up, because I think that this is a very stressful job, but it is important to know that, so.
Sorry, one last online question. Hello, do you see any future within San Bernardino County? We have a need due to a shortage in law enforcement.
Yeah, and Didi, are you gonna go to?
I cannot speak to it, only because I only represent the city of LA. Every county and city is gonna do how they can with the resources they have. We are a big gorilla, so we can give resources, and it sounds like a lot of resources, but the reality, based on the square footage, the number of calls, it's still very small. Same thing with all the other departments. They will do what they can. Obviously, number one, vision of the department, vision of the city or the county, and willingness to partner up with programs. Because what you guys don't realize, when you partner up with a program, you're actually going into an agreement. There is a lot of legalese that has to be put together.
Yes.
That is the hardest part. And once you start doing that with nonprofits go, whoa, we're done. Thank you very much. I'm not gonna do this. It gets very difficult. And the cities and the departments are like, remember, it is a litigious environment. They are always thinking about liability. Very, very, very difficult.
So I can totally give a much more positive spin on it.
Sorry.
The fact is that, so Didi Hirsch's 90-day center covers 5 counties, Orange County, LA County, Riverside County, San Bernardino County, and Ventura County. So it's a really large coverage area. I used to be a team of 1, now I'm a team of 2. Shaheen is finally going to make her hand. So she's actually helping me to be able to reach out to other counties to start similar 911 diversion programs. It takes funding and it takes a lot of work. But we're now, we're putting in the effort, so yes, San Bernardino County, we're coming your way.
Thank you.
Thank you, guys.